Importantly, anything that we talk about during the meeting or anything that, right, any materials or anything that we're referencing, right, we will be sharing immediately after, um, we'll be sharing immediately after the call, right? Important, I just want to level set because some folks from our counterparts in Demava reached out to us today, right? So the intended audience for this presentation, right, really are CoC leads, right? By name list keepers or any stewards of that effect, right? And some of our VA partners that are CoC liaisons and BNL coordinators have also hopped in, right? If you are not within those three audiences, right, you are welcome to stay, right? This is a public meeting, but that being said, right, probably a more germane meeting for what you may be looking for, right, would be the general stakeholder and partnership call, which will take place on the 27th of November, right, at 10 a.m. And so the QR code to register for that is there. And then we will also send that information, the registration link for that out. But then also too, if you are here hoping to get maybe a little forward or more information on the system enhancements that we will be providing through the open RFP opportunity with our office, right? That TA session is going to be on the 25th of November at 10 a.m. Again, you can scan that QR code if you're looking to do that, right? So just level setting, right? So hopefully we got we got one person that left. So hey, good to level set audience wise, right? And go from there, right? So moving on, right? As far as your facilitators today, right? So my name is Mike Callahan. If you don't know me, I know pretty much everybody on this call for the most part, right? I'm the director of the Office of Homelessness Prevention at the Department of Community Affairs, right? We also have Gavin Rozzi, who's the director of the data center, right, in the Division of Housing and Community Resources here at the Department of Community Affairs. He is the division's chief data scientist, right? Jamie Schleck, who's a special advisor for bringing vets home, will be joining us via phone. And then Rita Mirabelli, right, who's the program manager for the Regional Homelessness Collaboration Initiative, which is the program where all CoC interaction and funded activities fall under within, right, within our order of March over here at OHP. And then Talisa Jimenez, right, who's the governor's fellow that works with our office, particularly along that line of business with bringing vets home. So as far as agenda items, right, we've got three parts, right? I don't imagine we're going to take the entirety of an hour, although questions might, right? So the first part, we'll just do some level setting on bringing vets home and kind of what the initiative is, what we're looking to accomplish, and what that'll look like, particularly in the multi-phased rollout that we have, right? Part two is going to be we're gonna put forth kind of the initial some initial thinking and some asks to all of our CoC partners on the call and also to our county partners on the call. We'll be forwarding, particularly with part two, right? Immediately after this, we're going to be forwarding a document, right? That document is the release of information, right? That is going to facilitate the coordination, right, of information, not only in larger case conferencing items, but some other coordination activities, right? That right now the New Jersey HMIS release is not totally comprehensive around. Right. Then lastly, right, we're going to talk about a little bit more broadly about kind of our scoping assessment as we really start working towards what we in kind of engineering speak understand as a requirement statement for the statewide by name list and that infrastructure, right? And part of this is we have a survey instrument that we're going to be deploying to each of the continuums and each of the counties in the state. Thank you for attending the call, right? And what we really want to know there, particularly are the specifics around your by name list that you're currently operating off of. If you don't have a by name list, if you have plans to go and deploy one, particularly at the county or CoC level, and then most importantly, what that survey instrument is also going to capture are your current behaviors and standard operating procedures around case conferencing, right? So, right, just level setting going into it, right? This is very much the 30,000-foot view of bringing vets home, right? And kind of the phased rollout of that, right? We will have a much more detailed and probably a 2-hour long version of this presentation, right? A little bit past, once we get past Thanksgiving and into the holidays, we were just waiting for a couple different MOAs to be executed with some of our mission partners, right? So importantly, right? For folks that are familiar with the Department of Community Affairs, we use something called the Big Four system when we conceptualize or talk about anything, right? So importantly, right, with bringing vets home, what is the population we're serving, right? So we are serving persons experiencing homelessness in the state of New Jersey that meet the federal definition of veteran that are eligible for homeless services. We're servicing persons experiencing homelessness in New Jersey that meet the state statutory definition of veteran. And importantly, we are also servicing the service members, reservists, and National Guard members that, while not meeting the federal or state statutory definition of veteran for homelessness services, are experiencing homelessness in the state of New Jersey, right? And this is really unique to what we're doing throughout this effort. Importantly, right? So if you are a SSVF provider, if you are a federal provider, if you have a federal program or other program, right, or a CoC program, we are not changing the eligibility criteria or the way that you deliver your programs at all, right? What we are changing are these other adjacent and extra efforts that and extra secret sauce that we're adding to the effort that's really going to help us get to an effective end to homelessness within the state of New Jersey, right? With also those expanded populations. Importantly, there's no expectation, right, that if you are an SSVF provider or you are a CoC that has targeted federal resources that can only be served for people that meet the federal definition for homelessness, there's no expectation thereof, or nor will there be, that you expand out that eligibility at all, right? However, you can, and importantly, leverage bringing vets home resources in order to serve those folks with expanded eligibility, right? So what are the intended outcomes, right? And so as an important question within the big four, right? The first intended outcome, right, is an effective end to veteran homelessness, right? Everybody on this call is a very dialed into what that means, so we don't need to beat this to death, right? Simultaneously, right, a second intended outcome is that we move veteran homelessness and service member homelessness within the state to be rare and brief. And so kind of with foot stomping, this means that we will be enhancing, not replacing, the existing ecosystem of care to more rapidly ensure housing stabilization, right? And most importantly, we're going to ensure through this effort, right, that veterans and eligible VVH populations, right, that they have an accessible and defined pathway to permanent housing over these next 2 years, right? Importantly, right, we do have a national level auditing partner, right, that we are currently speaking with, right? We're not necessarily ready to make an announcement on who that is, right? I can tell you it's somebody we all know, and it's going to be really great because we're going to have a high fidelity and a high level of accountability, right, of this effort and the auditing process along the way, right? So importantly, right, who will provide care and direct the effort, right? Many folks on this call were kind of just introduced to the effort either via the Lieutenant Governor's announcement on Monday or via a release that our office did last week for a solicitation, for a $21 million solicitation for extra supportive services around housing, right, having to do with this effort, right? Importantly, right, the Office of Homelessness Prevention is the dedicated quarterback for this effort, as designated by the governor's office, right, for the state. We are working in partnership with the Department of Military and Veterans Affairs, so that is the state level agency. In order to do so, they are in the process of hiring someone to lead that effort. We have made our hire, right? So those folks in the South and that are affiliated with Philly know her very well. Jackie Tracalow, also prior to being married, Jackie Reese, right? We all worked. I worked with her. We worked, and she continues to work with a one team effort down there, particularly in not only achieving functional zero way back when in 2015 in Philly, but importantly, right, working towards that maintenance in some really challenging, right, federal and other state and city funding environments, right? So importantly, right, with the existing ecosystem of care, whether somebody's running a GPD program, an SSVF program, the HUD-VASH constellation, right? These programs will be enhanced, not replaced, right, by additional bringing vets home diversion funding, rapid rehousing funding, street outreach services, emergency sheltering, and hotel placement dollars, and permanent housing voucher programs through our state SRAP program and HUD's home vouchers, right? And the idea in deploying these is so that we generate the surge capacity to realize the effective end of homelessness within 2 years, right? Similarly, right, we were also deploying a portion of funds, right, to enhance and work on some of the data infrastructure and data work we've provided to 8 of the CoCs throughout the state, right, and also to some of the planning work we've done with all 16 CoCs around the state by standing up 6 regional hubs, right? And part of the procurement opportunity that is open right now is for a nonprofit organization or a community-based organization that's providing housing services to position itself and to act, right, as this regional hub, right? And importantly, as we embark on this effort and we cross jurisdictional lines, right, right, we really need to drive, right, that coordination across CoC, VISN, and county lines, right? Particularly, we have three state level VA entities, we have 2 VISNs, we have 21 counties, and we have 16 CoCs, right? That's a lot of folks and a lot of moving parts, right? And so how will people request help, right? There's 4 dedicated inflow mechanisms into this, right? So there's the existing coordinated entry systems. You could show up to, right, and we showing up to a VAED, right, working with other housing providers. But one of the things that we will also be doing is deploying some additional capacity to 211 through this effort, right? Similarly, right, we are requiring our community-based organizations that are contracting with us to deliver some of the emergency housing services, particularly in sheltered street outreach and emergency shelter and hotel placement, that they have a letter of intent and then move towards an MOU executed, right, with at least one statewide veteran service agency. So that means that when, Private Joe Snuffy shows up at the VFW in Cranford and is sleeping in his car for the night and says, hey, I'm going to end up sleeping here, right? Do you have anything that can happen? Or can you help me out? Or can you not bother me while I do it, right? Then that VFW has a lifeline and a dial-in directly to a provider instead of having to go through a multiple sequential process in order to get that person help, right? Similarly, right, we're also through our SimplyGov forms, right, which is the instance by which, right, we have public-facing forms that go to a secure backend database right here at DCA, right, using our SimplyGov instance, right, we'll be standing up a form for that. And then most importantly, right, through the Bringing Vets Home additional system enhancements, right, we will be effectively tripling the number of dedicated street outreach staff throughout the state whose bread and butter will be engaging with veterans experiencing unsheltered homelessness in encampments, sleeping in cars, or otherwise those conditions, right? So some of the challenges, right, by which we overcome through this, right, is we're getting past fragmented systems, right? You're on the first call, our kickoff call right now to talk about a statewide by name list, right? And particularly standing up the 6 regional coordination hubs, right? And this is really going to address the previous challenges around coordinating across the state, right, through various jurisdictions and systems, right? Similarly, right, we're with that four different spotted inflow model, right? We're really going to be driving towards kind of an all access mechanism of care, and simultaneously, right, we're also overcoming some coverage gaps, particularly some folks that, while not federally eligible to be known as a veteran, right, have service or have worn a uniform and being able to be served, right? Similarly, right, another concomitant and parallel process that we'll be doing through this is we will be deploying a dedicated team of landlord engagement, unit remediation, and also to rental sourcing with a pretty sophisticated tech backbone and infrastructure, right, to ensure that as soon as there's a unit available on the market and there's signal of that, right, that are bringing vets home to providers, but also to our SSVF providers or VA providers and our other providers that are touching, right, the veterans homelessness ecosystem, that they are receiving signal of that unit coming on the market, right, and the best contact information to do so, right. Gavin, who leads our data center, right, has really refined the process there, right, and when we go live with it in January, I think we're going to see some really great acceleration there. Simultaneously, right, if you're not aware, right, New Jersey earlier this year passed A4 S50, which completely revitalized the way affordable housing production is done in the state and calculated, right? And in doing so, part of our more broader efforts here at the divisional and department level are that we're really looking to lean into and work with our municipalities to go and say, hey, the state is driving towards ending veteran homelessness. Why don't we really start talking about leveraging our small unit production programs to help you meet these affordable housing obligations, and particularly not around a 200 unit redevelopment, but say a 4-unit rehab that we can go and work to make sure that it has 4 project-based vouchers through a National Housing Trust Fund project to go and make sure that unit can have a veteran's preference and serve this population, right, as we think more broadly and more further down the line from the standpoint of 10, 20 years, right? Importantly, right, Right, the CoCs and the counties are more than welcome to join in those efforts, right? But that will primarily be a state-led effort that we have also engaged with a marketing firm and a consulting firm to kind of quarterback that, right? So as far as baseline goals, right? So one of the things that we're really looking to do, right, over the next year and a half to 2 years, right? We want to clear the current in-program 2024 census of homeless veterans and get them into permanent housing, right? One of the things that we're doing in phase one right now is to create additional capacity in DMAVA resources, particularly the Vets Havens, right? As we work towards acceleration of housing placements and lease ups, right? We're looking to reduce the average housing placement time to 60 days, right, by the end of year one, and 30 days by the end of year two. And then the throughput that we're looking to achieve at minimum, right, is 50 veterans per month in year one and 75 veterans per month in year two, right? So all of you know this program landscape. If you're kind of conceptualizing the specialized veteran programs, right, understanding that homelessness, while not a linear process, is somewhat hard. It is hard to model without it, right? So understanding the client journey moving from left to right and kind of the existing programs that exist to do that, right? What we're deploying, right, through this initial $21 million RFP are the initial programs that you see in blue at the bottom, right? So we are in open procurement for these programs right now, right? One of the great things that we will be deploying is a ultra low barrier rapid rehousing program, right? That will dovetail very nice with the existing SSVF portfolio, particularly, right? That will definitely add value for those folks where in that kind of mezzanine space between, right, where the shallow subsidy might not be enough, but traditional rapid rehousing through SSVF might not be enough either, right? It's going to be a great program that fits that kind of mezzanine tier, right? Particularly, we already talked about street outreach and emergency shelter dollars, right? Similarly, right, another hallmark is being able to deploy some pretty substantial additional diversion funding around this. And also, two, housing navigation, and dedicated housing navigation agencies and resources to the system to include landlord incentives, remediation, but also to those post-tenancy services for folks that aren't necessarily engaged with HUD-VASH or, right, a tenancy support case manager, right? So importantly, right, given the landscape and kind of working across jurisdictions, right, we have to the largest extent possible having multiple competing variables here, right? We've divided the state into 6 regions, right? While some counties, right, while some counties and some regional COCs they fall in, right, into those regions, right? There's some counties that do not, right? And importantly, in doing this, right, we were also trying to apportion resources, and we also looked at the constellation and provider landscape to see where there actually was some space and flexibility to rapidly scale in this effort to go and do so, right? So importantly, right, with additional vouchers, right, at baseline, right, and this is without some extra capacity that we have baked in, right, we will be deploying a minimum of 533 home TBRA vouchers and a minimum of an additional 606 SREP vouchers, right. Through that, right, just with those voucher programs alone, right, we're talking about being able to house an additional 1,139 veterans, right? With the very robust rapid rehousing program, right? We're projecting right now the ways things are looking at funding levels, right? Being able to rapid rehouse a minimum, right, of 904 veteran households, right? So particularly, and this is in addition, remember, to the existing resources and everything that are deployed, right? So we're really looking at around 2,043 veteran households potentially to be housed through this effort, right? Just within these efforts, and assuming we're at full capacity, which hopefully will be about full throttle, maybe about probably about when we're at the 13-14 month mark, right? We shall hopefully be housing 85 veterans per month. And so assuming that there will be hopefully no more than a 20% year-over-year increase in the total number of homeless veterans, right? We're looking at, we'll probably be at +10 at that mark in that point of time, which is good, right? So looking at a process map of what the consumer journey looks like at a very high level, right? This is how we conceptualized it when we sold it to the legislature and the governor's office, right? Importantly, right, this call and subsequent calls after that are very much going to modify this process map, and all of you are going to have important not only stakeholder and capacity to go and do that, but particularly as we deploy and work with all of you, right, to be able to really refine and get down to a granular nitty-gritty level, right, the nuances of process that are really going to help and work and drive this together, right? So as far as timeline, and this is again very high level, right? Right now we're in phase one, right, which is the DCA internal sprint, right? We started off on the 6th of November, right? And so yesterday we trained, so we had an initial training with some of the Vets Haven South staff, right, on policy and procedures, right? We're working with to engage with some of the VSOs and some of the more broad folks that fall under Deputy Commissioner Solomano's office, right? And then simultaneously, right, we've been doing a lot of work internally with our public housing authority to ensure that we are operationalized and ready, right, to begin the voucher processing and issuance activities along the PHA, right? Good news, right? We are very much ready to go live and to start operationalizing those processes with our DMAVA partners only, right? As of the 18th of this month, right? We are very much going through a crawl, walk, run phase, right? And if we accelerate things a little bit more, right, as we go and do that, we will be able to open up, those vouchering opportunities to additional mission partners as we work through this a little earlier than projected, right? Importantly, right, right, and working and going through and some of the supports for those deployments of SRAPs and home vouchers, right, we're going to use the constellation projects that we have currently, right, within the OHP portfolio. So that includes the Documents Assistance and Supports for Housing program to provide pre-tenancy and tenancy supports, and also to our HPRP program to leverage a rapid rehousing component if so needed, right, for some additional items. Or a good example is landlord incentives and things like that, right? So importantly, we are ahead of the game, right, with our phase two, right? We have already deployed our RFP and open for procurement for some of the adjunctive and other support system enhancement services, right? It's looking like, knock on wood, that or knock on whatever this is, plastic something, right, that the first veteran using BVH resources will actually be housed right on or about the 20th. We have there's a veteran that was recently exited out of an encampment situation in Toms River. That household is working diligently with one of our providers and our Ocean Regional Office, right, to work through that lease up process, right? We are exactly going in right now, right? We are doing a couple different small scale marketing campaigns around the procurement opportunity for the system enhancement activities, right? If you'll be down at the league next week, we'll definitely be there. And then also too, right, getting with some of our external staff and getting in front of COCs to talk about the opportunity, but also to other providers as well. Right. From a more back of the house and middle office standpoint, right, Gavin and his team, right, we're standing up and working on the data architecture for the statewide by name list, right, and engaging with our partners at Monarch, our partners with the HMFA, setting up those calls, setting up some stuff with Foothold, right, and then now importantly, right, engaging in the system change briefs, right, so this being the first one having to do with the by name list, right, and really meeting and talking with our mission partners around this, right. As it looks right now, right, we have a target start date for phase three of being able to deploy, right, being able to deploy not only the system enhancements but the other stuff that we're going to talk about, right. It is a very aggressive timeline, right, to the extent possible. It is the expectation of the front office that we stick to it as much as we can, right, and not one to make Uncle Phil angry. We will go and do this as rapidly as possible, right. Importantly, right, some of the stuff and some of the milestones there, right, are bringing vets home trainings complete, regional and CoC by names list ingested in the ETL processes. For those being complete, right, the SimplyGov instance stood up. And then also too, with Jackie and her counterpart standing up and some of the regional entities being stood up, right, move into regional daily by name list stand-ups, right, and then weekly ops staff calls to really drive accountability and deployment of resources, right. This is also, right, when staffing concerns with our housing authority, when we're really looking to open it up more broadly to the entire constellation of any provider entity, right, providing services to an eligible VVH population, right. Phase four is really kind of that Q1 reporting we're looking to. So one of the things with this is we will be posting a published dashboard with that to talk about efforts and also to showcase, right, the wins as we go through. Right, and also to drive accountability, because that's an important part of this, right. Many of the things in doing so is DMAVA, our partners over at DMAVA and our sister agency, right. They've been very generous with some of their training spaces, and This is going to be a very much a higher touch process than probably the majority of folks and the majority of COCs have been used to ever in the state, right? One of the things that we are looking to achieve, right, as far as some system behavior change through this effort, right, is greater coordination throughout the state, right? For folks who know our office, right, I'm also the executive director of the New Jersey Interagency Council on Homelessness, which hopefully, right, very soon the governor will be announcing his appointments to the body. And through that, right, we will, right, and through that, importantly, right, we will memorialize a lot of the lessons learned, but a lot of the great things that we will be doing, right, more broadly across the state alphabet soup agencies, but also too, right, in the system itself, right. With that being said, right, we'll also be talking about and beginning the purposive marketing campaign, right, to accelerate landlord and public engagements, and also to solicit and work with some very pretty high powered nonprofits and foundations, right, to drive not only housing production but some additional downstream and sustainment supports, right, once this initial funding from the state is gone, right. So importantly, right, we ran through that really fast. Like I said, right, you will have access to this deck immediately after, right? But now we're going to go into the Bringing Vets Home Release of Information review, and particularly because we're asking for your feedback, right? Um, while we have had to keep this pretty close to the chest up until this point, right? Now that, if you're a fan of the Iliad, right, we have very much, right, we have landed at Troy and we have burnt the boat, so there's no going back. And as part of this, right, we can very much now engage in purposive external stakeholdering, which will continue, right, because your input is not only valuable, right, it's very much needed if we're going to do this together, right? And so one of the first items, particularly that we'd like you to review and just look at, right, is the release of information, right? So when we look at the release of information, it's a 3-page document, right? It's right there on the right if you want to see the first page, right? And you'll get both a PDF version and a Microsoft Word doc version immediately after this presentation, right? The key areas that we really need your input on, right, are the data sharing scope and permissions, right? Agency list completeness, right, for covered agencies, your feedback on clients' rights and protections. Now, importantly, right, our legal review has already given this a once over, right, but we will also have to be socialize it with our partners over at HMFA and also our partners over at DMAVA, which will happen through a centralized review process at the Office of the Attorney General, right? And that being said, right, we're requesting that any feedback you have, and you can just take the Word doc, throw it on some comments, and then you're going to see the email address at the end of this presentation of where to send it to, right? We really need the feedback back by November 22nd. Right. And that's so that we can scrub it all, collate it, make any adjustments as needed, and make sure that we pass it up to our department's DAG by the 29th so that we can keep on going. Right. Similarly, right, we also want, your take on on integration with existing releases of information, right? For federal partners on the call, there is a carve out, right, for federal stuff that are saying that this does not supplant nor supersede or do anything to any federal requirements for any release for any federal agency. So obviously the VA release this does not supersede or override the VA release or the Social Security Administration release or anything like that. Right. And so here's the reason for the critical feedback for this, right? So your input matters throughout this entire process, importantly, right? We want to ensure that there's compatibility with local systems. We want to ensure that if there's regional privacy concerns, that you're flagging that for us and letting us know. And we also want to validate, right, existing agency partnerships, right? And simultaneously, right, we really want user experience and client design to lead by this. And this is a very plain language release of information, right? And with this, right, we want to know, particularly within these 3 thematic areas, right? So with regards to operational alignment, right? How does this integrate with your current processes? How could you envision it integrating with your current processes? Would it be disruptive? Would it be helpful? Or would it just be a task that maybe that someone has to do and it would add just another piece of paper, right? From a sense of client experience, right? One of the things that we do is, so if you don't know, the Office of Homelessness Prevention, we provide funding through our partner in Monarch. We provide funding to the CoCs, all 16 CoCs in the state, to stand up and engage with their advisory boards, right? And with that advisory board, with those advisory boards, both the CoC level and the state level, right, we will be soliciting their feedback, particularly on this, right, and what they think of the form and that, right? And simultaneously, right, if you have a more local group of stakeholders that you want to get it in front of and have a member of our team go and do so, we are more than happy to do that as long as we stick to the deadlines, right? Lastly, right, the last thematic area with focus that we really want insight into, right, is implementation readiness, right? Is so understanding this form, and if we make a couple tweaks here and there within the left and right limits of it, right, what support do you envision your organization at the CoC or county level needing from a training perspective in order to operationalize it? Right. And so we ask you to be thoughtful about that, right? And think somewhat deeply, knowing very well, right, the folks that you lead and their requirements. Right. So moving on to our next part, right? So the by name list infrastructure assessment, right? So importantly, right, before we even get to anything about a statewide by name list, we have to engage in good engineering practice, which means that we have to create requirements, right? Um, Importantly, this is our high level timeline, right, for the BNL, right? And so if any of you are wondering, well, how come the office can do this, right? The statutory authority, which grants the Office of Homelessness Prevention, right, access to all homelessness information in the state of New Jersey is referenced there, right? With regards to kind of our next 3 months, right? We're having right now the 14th, the initial planning meeting, right? Some entities, a good example is, right, we're having a different meeting with Monarch, we're having a different meeting with Candy and her team, right? Doing some initial planning and laying the groundwork for what's going on. Similarly, right, we will be reaching out purposively to our friends in Bergen and Middlesex, right, as they have two different HMIS systems that, while uploaders into the statewide HMIS system, right, don't have a direct connection for all things, right? And so during the 18th through the 29th, we're going to be continuing with this requirements gathering process, right? And then through the 25th through the 29th, even though that's the week of Thanksgiving, right? That's when we're going to kick off, right, the system design and CoC workshops, obviously allowing for Thanksgiving and the holiday, right? So there is a chance, right, that we may be pushing this to the right a week or two, right? But we're trying to stick to it as rigidly as possible, right? In December, right, the 2nd through the 20th, right, Gavin's team is going to be taking the lead on technical development and integration, right? Hopefully, right, within December through the 16th and the 27th, right, we will have just exited the procurement process, and we'll be engaging in a very aggressive scoring timeline, right, to identify the partners and have the commissioner's approval for that, right, to go and set up that back end system for that, right? And then engage in some pretty substantive user testing between the 23rd and 31st, right? Ideally moving into January, and again, we may adjust this by 2 weeks, right? Staff trainings across the board is for the 2nd through the 10th, do potentially a hypothetical soft launch on the 6th through the 10th. And then right now we're going to work towards it, although I don't know how much we're going to have this land, is have a full system go live on the 15th, right? And so importantly, right, as we go through this requirements process in this first phase, right, we need the CoCs or your lead, either the lead entity, right, that performs CoC duties, or if you are a county, right, and you are the collaborative applicant, right, we need two people to be filling out this survey, right? We want to make sure that it is a member of your executive committee that has insight into the granular level of everything, right, that goes on with everything by name list and case conferencing within your continuum, and right, the keeper of the by name list, right, because there are some structural questions about that list and how it is operationalized within your continuum that are really going to drive, right, how we shape out and scope the state BNL, right? And so if you want to look at the key domains, right, that this survey instrument will go, of which, right, you're going to have an email link immediately after this. There's a QR code embedded in the end of this presentation that you will also have access to, right? We're assessing the current by name list structure and processes, right? Your data collection and quality control standards that you have within your continuum, your case conferencing practices, right? Your system integration capabilities, and also to your resource allocation and current staffing, right, around a veteran by name list, right? What's really great about the veteran homelessness community within the state is, as evidenced by everybody on this call, is that someone owns that by name list already in the majority of the communities throughout the state. Unfortunately, with other populations, that's not the case, right? So as far as you're planning for thinking about the survey, right, that's pretty much an overestimation. I think you'll probably be able to get through it right in 15 or 20 minutes, right? It's a Microsoft Forms survey. We are asking that this survey be returned to us, right, no later than November 22nd, right? A great thing about the survey is Rita gets an email every time that there's a response, right? And then she goes and checks off, right, where it's from, right? And Rita's just going to be sending gentle reminders, right, as long as we get along right to the 22nd, right? And so understanding the critical role of this, right? And so this is why we need to do this, right? So it identifies our existing infrastructure. And like I said before, right, the intent of the Bringing Vets Home initiative from the governor's office, right, is not to replace, it is to enhance what is going on already in our continuums, right? We have 2 counties in the state that have already functionally ended veteran homelessness and that are aggressively working towards the maintenance of that, right? We have other areas across the state that have really purposefully done super engagement. I'm thinking about the crew up in the north, right, with 140 vets housed just in this year alone, right? Importantly, right, we want to identify and honor that existing infrastructure and those relationships to include, right, the case conferencing activities that are working really well in some communities, right? We also want to reveal kind of the integration challenges, right, for Gavin and his team and see what that's going to be. We're also going to kind of understanding and have a good mapping then following this, right, of data sharing needs across the regions, across the state, and across CoCs, right? And we're also going to hopefully have, lastly, an identification of resource gaps, right? As far as the timeline, right, we're looking for this instrument, right, and it aligns with what we were talking about earlier in that last roadmap slide, right? So November 14th through the 22nd, right, the survey completion, initial data collection, the 25th through the 29th, right. We'll engage in the analytics and technical requirements development. Importantly, right, there is a call, right, that we will be having during that week where we will socialize the findings with everyone, right? And this will be a participatory process whereby you not only see the findings, but we will hopefully coalesce it into a digestible document that is actionable, not only from the perspective of how by name lists and case conferencing activities are working within each CoC, but how they align and how they differ across the state, right? Similarly, right, from 12.2 through the 12.13, right, that is where the hopefully nascent and the ask at the end of this is for folks that want to participate, right, in the work group to go ahead and help us build this, right? That is where a lot of the system design activities are going to happen, right? For those interested, right, that QR code right there takes you to the survey. If you want to go ahead and preview it, right, again, everything is required as far as answers to questions, right? So you can't really skip through it that fast. So wrapping up and just being cognizant of it is the end of the day, right? And leaving plenty of time for questions, right? These are the deliverables that we were asking for with solicitation for your buy-in and your participation, right? Immediately after this call, right, you will receive the Word document and the PDF version of the release of information, right? For everyone that is registered and that has participated, right? We are asking you to send that to Talisa on our team, right? No later than close of business on the 22nd, right? Feedback on that document could be as much as, hey, it looks good to us, or hey, I think we could make the following adjustments here, here, and here, or maybe this language is a little ambiguous, something like that, right? Similarly, right, with our by name list infrastructure and case conferencing assessment, right, we're also asking that to be returned no later than, or completed no later than close of business on the 22nd, right? There is the direct link right there. There is the QR code if you'd like to scan it, right? And importantly, something that I'd like to calendar for all of you right now is that the next working group around the statewide by name list is going to be Tuesday, the 22nd at 3 p.m., right? You can click the link right there to go ahead and register for that call. But that is when Gavin and myself are going to go ahead and lean into some of the findings, socialize that, right? And then we're going to do a little more community engagement and kind of work group and sub work group committee generation, right? So that being said, right, we just dropped a lot, and I'm going to stop the share real fast, right, and then we'll open it up for questions more broadly. So Rita, if you don't mind just moderating that'd be perfect. Thanks.
I don't see any questions in the chat yet, but I will read.
Oh, it looks like
I got a question. Yeah, I got a question. So I run 3 different county by name lists. Do I need to do 3 separate surveys?
You from Southern Regional or Northern Regional?
I guess I'm running multiple surveys. Burlington, Somerset, and Middlesex.
Right. So Corey, I think your counterparts from the counties are also on, right? So, I would maybe coordinate with them to that, and I'm sorry for your pain. So,
That's okay.
okay, sounds good.
Hi, Pete Wine, Veterans Multi-Service Center. I think I'm going to be in the same boat as Corey, but I run in the southern area. I'm doing 2 of the regions now, but it's a CoC with 4 counties. So I take it we're going to be doing multiple ones as well.
Yeah, so Pierre, I would get with Anita, and I would get with Anita, and I would get with Rob, and I would get with Lisa and the regional team, right, and just connect with them on that to see whether they want you to do both, whether they want you to do part of that, right, but also to the Cape May team and also. So,
Okay.
if you want, that's probably an offline conversation, but happy to broker that for you, right, if that would be helpful.
Thank you.
Okay, Mike, Joni Owen in the chat says, will the completed ROI be part of the veterans record in HMIS?
Right. So, Joni, great question, right? So part of this document is we have the expectation that all of these documents will be put in the client file folder or client file cabinet within New Jersey HMIS, right, and stored there. And also locally. And Joni, importantly too, right? There's some more precise directions on storage and kind of what the after actions are expected at the case management and organizational level at the end of the form. So definitely mark it up and flag anything that you feel like is relevant there. Don't worry, Rob. You don't need any matching funds. I got you all day, buddy. No matching funds needed, but our matching funds are always appreciated. But importantly, for the RFP opportunity, for the system enhancements, right? There's no matching funds required.
Joni, do you have another question?
I was just going to say, the VA currently does not have direct access to HIMIS, so we'll have to discuss like how, veterans who are just working with the VA, we'll have to make sure that they're working with an agency that can access HIMIS to have that ROI signed and uploaded, and and we'll work on that. So.
Yeah, thanks. In particular, right, that's also too one of the functions that, just on the whiteboard we have listed for the regional coordinators to provide to VA partners if needed.
Kelly, do you have a question?
Yes, I had a question. I think it's great that National Guardists are going to be included as part of this initiative. I'm just wondering, though, if they're reluctant to sign the release of information, how will that kind of work? Because traditionally they're not eligible for some of, most of our programs for people here on this call. So I'm just curious how that would work in terms of data sharing, information sharing.
Right. So importantly, right, the signing the release itself and the mechanics of that, say for a National Guard member, right, that has no federal service that would go and be part of that, right, they would only be eligible for BVH programs that have that state funding, right, that don't touch your programs. But similarly, right, one of the things with this is through the statewide BNL and even the regional BNLs, right, we're really going to be working with de-identified information using PIDs, right, and just secured strings and not the names. But Kelly, that's a great flag at baseline. So definitely have that on the workflow.
Thank you.
Thanks, Kelly. And Sean, do you have a question as well?
You're muted, Sean.
Sorry about that. Sean Hudson, Director of Veteran Services, Bergen County. I work with the shelter and the different SSBF providers and the VA to make sure that we're taking care of all the veterans in the county. Maybe it's a little early, but I know you had mentioned something about the VSOs and the MAVA have been getting training. So moving forward, should we incorporate them in our meetings that we have, or do we for referrals? How's that going to work out?
Right. So, Sean, that's a great question. You're about a month and a half ahead of where we're at. So, right? Just kind of on the timeline there for that, right? Part of this is with our sister agency, we need to kind of just get a couple of things, some footing there, right? And more integrated into the larger system, right? And then once that's there, right, there will be, defined, not only defined goals and milestones, right, for them to go, but they will, I feel like there will be a baseline increased facility to go and just jump in with more of those county partners that have a more structured system.
Does anyone else have a question they'd like to put in the chat or ask on camera or off camera?
All right. Well, seeing that there is none, right? Again, right, I'm going to put my email in the chat real fast. You're going to have Rita and everybody else's contact information after this, right? Please review the materials. Please take your times and be thoughtful, right? With the survey that we have out, right? If you find if there's hiccups, if there's anything else going on, just let me know, right? And let our team know, and we will gladly engage and kind of troubleshoot with you, right? So other than that, really looking forward to working with all of you a little bit more closely, right? Some folks, hey, we're just continuing the relationship we have already. So, right, that being said, hope everybody has a great day, and I will give you back 13 minutes. All right, take care. Bye-bye.